Good morning to everyone again. So we are about to start with the next plenary session on health and nutrition for global wellness. May I request our moderator for this session and all our speakers to kindly come up on the stage. I also have the privilege of introducing our moderator for the session. So Natisha is a leading public health scientist whose interdisciplinary research advances and equity, sustainability, and leadership in science. So she has a PhD in public health and over a decade of experience as a medical scientist. Without further ado, I'll request Natisha to come over and take the stage. Thank you.
Thank you, Nishant, for that warm welcome. Good afternoon to everybody. It is really an honor and privilege to moderate this session for this plenary panel, which is titled Health and Nutrition for Global Wellness. I have the privilege today of introducing you to a dialogue that will be with 5 esteemed panelists. But before I do so, I want to share a small background of this panel. The health of our global populations faces both persistent and emerging challenges that range from childhood obesity, mental health in younger generations and older, rare diseases, clean water access, emerging infectious diseases, and the role of digital health technologies. Yet, with these challenges come opportunities as well, reimagining healthcare access, to embrace innovation and to embed equity and sustainability at the heart of global wellness strategies. This panel is an invitation to think across disciplines, sectors, and geographies to address the question, how do we translate scientific knowledge into inclusive, actionable strategies that improve lives? So without further ado, I'm going to introduce each of the panelists. Currently present are 4 of the 5 panelists. I will introduce the first panelist, which is Dr. Debashish Mitra, the Vice President of the Indian National Science Academy, INSA, who is also involved in international affairs, with expertise in molecular virology and immunology, and science diplomacy, bringing insights into the science policy interface. Welcome, sir. I then have the privilege of introducing Dr. Liz Milvet Garcia, an immunologist, policy advisor, and former advisor for sustainability at the U.S. Department of State, Bureau of Global Health Security and Diplomacy, a GYA member who brings a global health and science communication lens. Welcome, Liz. I now have the privilege of introducing Dr. Rakesh Kumar Pilania, an assistant professor and pediatric immunologist from the Postgraduate Institute of Medical Education and Research, who is an INEAS member who works to address child health and rare diseases in underserved contexts. Welcome. And last but not least for now, I have the honor of introducing Prof. Sanjay Bihari, the director of Sri Chitra Tirunal Institute for Medical Sciences and Technology in India, a leader in medical sciences and health technology with deep insights into institutional innovation and translational care. Welcome, sir. I have one more panelist to introduce, and in absentia for now, it's Prof. Remy Kwaran, a neuroscientist and president of the International Network for Governmental Science Advice, more commonly known as INSA, who is also deeply involved with GYA members and alumni, have connections to the regional INSA groups, who will offer insights into the policy science interface as well as trust in science. So we've decided that our panel will we kick-started on a different note, unlike the other panels. I would like to point a question to all our panelists, and they will share their perspectives thereafter. So panelists, in your work of bridging science and government, what have you found to be the most effective ways that scientists can influence health-related policies? And especially since we have a young audience, how can young researchers become more involved in science advice structures globally or nationally? Thank you. I'm going to hand over to the first panelist.
Thank you so much for the question and for the opportunity of being here, for the invitation. Well, I'm a science communicator, right? But I'm also an immunologist by training. And I think one of the most important aspects is how we communicate science to policymakers, to diplomats, especially when we are providing advisory, right, in certain topics to influence the evidence-informed policymaking process. In that aspect, I believe that science communication has to be tailored to the cultures and necessities of the audience, as well as the trust and the relevance and the respect has to be there all the time. Also, the messages that we're trying to convey in this scientific advisory process must reflect local health priorities, languages, nuances, and it's not only like this, the way that we speak, it's everything that is related to a language, right, and a way of living. And also it has to reflect historical contexts. So part of what I did with the State Department was working with Mexico, and I'm gonna be talking about that. And one of the ways that we establish those relationships and promote scientific advisory was partnering with local leaders, civil society organizations, and acknowledging also geopolitical dynamics. I think that's very important when you're advising science for policymaking. And lastly, I think transparency is critical at the same time as empathy. So all these elements combined, I think, are, for me, fundamental in this scientific advisory role.
Yeah, so continuing with what you heard just now from her, I think, communication with the policy makers and also the community, both are equally important. So local communities, regional communities, they should be made aware. The scientists should be in constant, touch with the community and with the policymakers. And also, it's important to bring, public health into education, in general education, so that, people are aware of what is good and what is bad. And that should be there in general education for all, not for only specific students. So I think these 2 points are important to go ahead and influence the policy advisors. Thanks.
So thank you for the question. Basically, this is like now, because most of the things has been covered, but I would just say that it's a holistic approach. We have to include, and like basically I would say that engage, advocate, and change. So if we have to engage several stakeholders, basically from the starting from the, if I'm talking about the health in children, starting from the patient, families, then the grassroots clinicians, primary health clinicians, then researchers, scientists, and so, and then we have to take a views from the all, and then we convey in a language that is more holistic and more targeted to policymakers, that how the benefit of doing something, which what some intervention is getting into the, so because at a policy level we have to know that something which we are doing, whether it's a doable or what are the, like now, what are the cost effective ratios. So that's what, so we have to involve several collaborators, several stakeholders in that, and then possibly that will make us like now, we have to discuss and like come to that what we can do further for the root cause of the some problem. So I'm not giving some examples, but still I'm just thinking that. But
thank you. It's a privilege to be here. My mantra is IDC. What does this stand for? Immersion, diversification, and consolidation. What does immersion mean? seeking out experiences which are quite different from your own. So if you're an engineer, then please go to the operation theater. If you're a doctor, please go to the labs. If you are a person in the government setup, please go to the private setup and see how it works. That's the first aspect, immersion. As soon as you get into a position of immersion, it makes you uncomfortable. But then gradually what happens is you learn from it, you adapt to it, and then you suddenly understand other people's perspectives of how you will do certain things. The second is diversification. It's a business mantra. If you continuously pole dance and just go on doing the thing that you were doing, always what you're doing, you have to do it again and again. At some time, you will reach the end of the pole or you'll fall. So continuously diversification into new areas, meeting new people is a very important point. And the third very important point is consolidation. What happens is most of us start very enthusiastically, but we never sustain it through. We just have one visit and that's the end of it. We just go for one immersive experience and then we never take it forwards. Real science only happens when people become friends. No matter what policy you make has any meaning on the final consequence of the outcome. So to become friends, you have to consolidate relationships. And this is the third point. So to just repeat, immersion, diversification, consolidation. Thank you.
Thank you so much. And I have the privilege of introducing Prof. Remy Caron from INGSA. As I said, Prof. Remy has vast experience in the interplay of the policy-science interface. Welcome, Prof. And if you could share your perspective in terms of bridging the science-government interface, what have you found to be the most effective ways that scientists can influence health-related policy?
Well, first, I'd like to thank the organizer for the invitation. Really a pleasure to be with you here today. Sorry if we're a bit late. It was a bit complicated to get here. And again, thanks to the organizer because I had asked to delay my participation by 1 day because I had to be in Nice, in France, for United Nations Conference on Ocean. And basically what we'll be discussing here today, or what you discussed yesterday, applied very much to ocean. If you think of health, nutrition, and global wellness, the ocean are one of the key elements. So I encourage you very, very strongly, all the young ones in this room here, to look at the outcome of the conference, of that conference, and look at the recommendation and start to be involved. I think very, very important. We count on you. My day job as a Quebec chief scientist, but also as chair of INGSA. If you don't know INGSA, just a couple of words on the organization. Over 6,000 members in 130 countries. So it's very global, and it's free. So please join and interact with us and the colleagues all over the world. What's the main focus of INGSA? Building capacity in science advice globally. And it's one of the first organizations that started in the Global South. It was established 10 years ago. And we work with chapter in Africa, chapter in Asia, chapter in Latin America. We just opened a chapter in Europe, and now we're building one in North America. So building capacity is absolutely essential. How we do that is basically courses, workshops that we organize all over the world. Key words from me, and I think one of the colleagues here mentioned that, these are not, if you want science advice to be successful, it's not a one-time meeting. You have to build trust between the various partners, and it takes time. You have to do that and repeatedly go back, explain what you do, and explain what you do in different type of words depending of who you're talking to. The other very big thing for me over the past 10 years now is trust. So you have to build trust, you have to build resilience. Because also often in government, in many governments over the world, the high-level policymaker, they change a lot. So you start to have trust with one team, they move to something else, you have to start again with another group. So two key words in terms of science advice and being successful: resilience and trust. And what was mentioned by colleague here as well before, do not be afraid to challenge yourself and to work with other type of expert. So doing very multidisciplinary type of consultation is absolutely essential. And then involving the public, citizen, absolutely key, and we forget about that too often. So what we're trying to do at INCSA is build advice at the global level. Let's think of United Nations, at the national level in a country, at the regional level in a state or a province, and at the very local level in cities, municipality, working with citizens, and that's there, I think at the end of the day, there will be the greater impact. So we have started a program, and I would like to discuss that maybe with you in the room here, program for you, for younger generation, to go to work in cities. So maybe instead, if you're a chemist, instead of going to do a postdoc in a university in chemistry, there's nothing wrong about that if you want to do that, but also if you prefer to start to learn science diplomacy, science advice, building science advice, we offer you training award to go work in cities. And that you see very science policy in action because you're closer, in a sense, to the decision-making process. So I will strongly encourage you to interact with us on that front. So again, keywords: trust and resilience.
Thank you so much. And as I mentioned before, we have, an audience of young scientists. So my next question to the panelists is that each of you have, a long track record in terms of your background as a scientist, as a science communicator, as a policy advisor. Given your background, how can health institutions better partner with researchers and policy actors to fast-track impact at the community level? Because we know there is this current gap between policymakers and researchers. So with your backgrounds in mind, what advice would you have to offer young scientists in how we bridge that gap between policymakers and us as scientists and researchers?
Yeah, during my presentation, I'll talk a little bit more about that. But going back to the science communication piece, right? I think science communication is not a soft skill. Some people refer to it as a soft skill, and I don't think it's a soft skill anymore. And I think it's important, as I mentioned before, to build that trust with the community and with the community leaders. For example, while I was at Mayo Clinic receiving my training for my PhD, I partnered with leaders from the Somali community to address misinformation and vaccine hesitancy. And the way to get to the rest of the community from the rest of the Somali community was partnering with the leaders, right? I'm a Puerto Rican myself, and minorities, Latinos, we rely a lot in our community and on our leaders, so I think that's very important. The other way to bridge that gap is through fellowships, and I'm going to be talking about that during my presentation too. I'm a AAAS Science and Technology Policy Fellow alumni. I'm also an alumni of the Inter-American Institute for Global Change Research STEP Fellowship Program. And these programs help to bridge that gap and help to train scientists to speak in the same language as the policymakers, right? And it's like an immersion program that places scientists in government agencies. And I think mechanisms like that unfortunately are in jeopardy in the US right now because of the current administration, are essential to bridge that gap between scientists, policymakers, and the community as well. So.
maybe I would just add a little bit to what I was already mentioning in terms of training opportunities in cities. But in Quebec, in the province of Quebec, in Canada, we have the same thing also at the level of ministry. So PhD student at the end of their PhD can go for 2 years, and you see how it's done in government. And we also have opportunity to work in office abroad, Quebec or Canadian office abroad, embassy or whatever, to work there for 2 or 3 years. So you learn also the practice of science advice in a different context. And one key piece here is science diplomacy. And more we are talking about that, about science diplomacy. It was critically important, I think 6 months ago. But since the re-election of President Trump, it's even more important. So talking science with different communities, some group believe in it, others do not. So bringing diplomacy, bringing science in embassy for diplomat is absolutely essential, and we have various programs that we have started on that front as well at INCSA.
Yeah, so thanks. I am a basic scientist, right? Biomedical scientist. So last 25 years I have been working, and what I learned that it's very important that you should be clear that whatever you are doing, why you are doing it, and you should be able to communicate that to your peers, not only peers, also to the people around you and to the community. Most importantly, there are people do science to find something very fundamental, which may not be useful immediately, but could become useful later, or somebody can make use of it. But science now needs, that what you are doing, it should have some outcome. And in order to have that outcome, you need to interact with people, the kind of work you are doing. So, I will give 2 examples. We have 2 issues which are important for, India and many other countries also. One is drinking water, safe drinking water for people. We have improved a lot, but it's still not enough. We need to do more. In order to do more, people who are working in this area, they should, be able to understand the ground reality and communicate with the people how to make, possible that every individual should be able to have access to safe drinking water. Similarly, another example which has come up in aggressively in last 10-15 years is mental health. So people who are working in the area of neurobiology or neurodegeneration, right? They should be able to interact with people who are in the clinics, who are working with people having mental health issues, and they should be able to, do some kind of work which could be translatable and useful to the community, to the people having mental health issues. So basically, to interact and not to work in silos is the mantra I would like to give. Thanks.
So thank you for the question. Basically, what we are discussing is that how to increase the interaction between the policymaker and young researcher. So basically what we are doing is that also something like young researcher is also part of this panel discussion, and we are having a policymakers almost and like a senior scientists. So we have to make a dialogue, collaboration. That is something which we should start. That how we can achieve this that youth representation. Second thing is that we have to train the young researcher in a policy making decisions. Like the training should start. So once they reach the level of the policy making decision, how we can involve the young researcher. And possibly one more idea which I can give, like which I thought, is that we have to increase the foster the youth representation in the policy making decision. So then that it will make a that how to because that how to interact with the young scientists, and how to increase their increase their output, because that they will once they will be part of those committees and part of those part of these committees, then possibly that they will represent that youth science representations.
Thank you. So from personal experience, I've worked in several countries, and now I'm head of an institution where public health, deliverable health, and biomedical technology development and basic science, they all amalgamate together. And so there is a 10-point program which I think each youngster should actually focus on. The first of them is, you have to create areas where where people with different backgrounds come together. So for example, in your own department, you can actually get people from outside to come and actually interact with you. That itself gives you a huge vision. And likewise, you can go to other areas and actually learn from the other places. So that's the first thing. Create areas where different faculty may come together. The second very important thing is you have to consciously make an effort to involve yourself at the ground level. How can a biomedical technologist actually make instruments for neurosurgery unless he or she actually enters the operation theater and actually sees what the ergonomics of the operation theaters are? The doctor has trained to think in a particular way. The technologist will be trained to think in a particular way. When you are in the same environment, then it will really lead to an enhancement of the environment. So involve yourself at the ground level. That is the second point. The third important point is try to increase your circle of influence. What happens to each one of us is that we try to contribute individually. When we try to contribute individually, we only do a little bit. Like for example, if I'm doing 10 surgeries a week, I'm only doing 10 surgeries a week. When I'm training my students to do 10 surgeries a week, then it actually increases 10-folds if there are 10 residents. Then if those 10 residents write books, make devices, publish articles, then suddenly this circle of influences increases far, far beyond your own lifetime. So this is another very important thing. Please make a conscious attempt to increase your circle of influence in your own small way. The next thing is Freakonomics. This is a beautiful book that I request each one of you to read. Freakonomics means every single thing that you do at any moment in life has to be translated into finances. If it is not financially viable, it is useless and it is not self-sustaining. If we are sitting, all of us are sitting together, each one of us has been given a ticket to come here, to sit here. We have all spent money. And if it is not financially viable, this knowledge dissemination is not financially viable, then the whole effort is useless. So whatever you do, please look at Freakonomics. The other very important thing that we often neglect is getting community leaders to come and teach. And that is something at the ground level. If you have somebody sitting in Rajasthan who's made the canals there, come and actually teach you in IIT Hyderabad, suddenly you will learn perspectives at the ground level, how the panchayat system works, how permissions are given, which you have no idea about. This is another very important thing. Having industry leaders becoming adjunct professors at your training programs. What we do is they have a very good immersive experience, and we never invite people from the industry, people from other organizations to actually come, say people from NGOs to come as adjunct professors and teach all of us. They will give us a huge experience here. Then very important area is, please learn about areas which are completely unknown to you, like patents, how to publish, how to do scientific communication, international laws, income, finance, and administrative laws which govern the land, funding, work with technology business incubators, which actually, this is a very specialized field. And as scientists and engineers, we don't know anything about it. And there are specialized people working on it. And finally, the most important thing is, whatever are the policy changes which are taking place in your own nations, you must be completely aware of those policy changes, because they directly affect your life, and you think that they are not your business. So these are some very, very important areas which really help you develop a very good rapport with the community and with people surrounding you. Thank you.
Thank you so much for those perspectives. I have two panelists who have presentations, so I want to give them a chance to share these presentations with you very quickly. But before I hand over to Liz and Rakesh, I want to give Prof. Remy a chance to add to some of what he would like to share with us. Over to you, Prof. Remy.
Thank you very much. And maybe just related to the topic of the session, health, nutrition, and global wellness, and a few things I would like to mention to you. I'm pretty sure you're aware, but I think we need to build and quite a lot, is the concept of One Health or planetary health. So there it's, of course, human health, but it's also the health of biodiversity, the overall health of the planet. And I think what we discussed since the beginning of the session, you cannot do that on your own, of course. Was mentioned mental health for you. I'm a neuroscientist by training. That's not enough. You need to work economists, you need to work with policymakers, of course with medical doctors, with psychologists, with all geneticists, all kinds of people that will be able to foster the development of the One Health concept and data and impact of the One Health concept for everyone, each individual on this planet. I think we saw during the pandemic, the COVID pandemic, a lot of inequality. We tried to find ways to resolve that, open science type of approach, but we went back into our old shoes very, very quickly. So we need to learn from these type of events. And my last point, a great opportunity for you, for everyone, is a big project that was just launched a few weeks ago in Washington, D.C., at the Bloomberg Center, Johns Hopkins University. It's on exposome. So yes, your genetics, your genomic is very important, but everything else around you in terms of environment, so even social environment, have impact on the incidence of many, many diseases. So it's a huge project that is just starting, at least 10 years, 15 years project to bring on board really the One Health concept. At the moment, they asked me to kind of chair a group which would be more looking at social and ethical aspect of the project, leaving no one behind. Because at the moment, it's very much focused, I would say, on North America and Europe. We need to bring you on board. We need to bring the Global South on board, otherwise the impact of the whole project will be highly diminished. So if you want to know more about that big project, which relates very much to health, nutrition, and global wellness, I'll be very pleased to discuss with you.
Can I make one point? Actually,
Sure.
Just to give a very practical example, during this COVID pandemic, I was head of neurosurgery at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. And I was given two tasks. One was to manage the ICUs of the COVID pandemic. And the second was, so I would base the hazmat suit go inside every day, morning, evening, coordinate everything. And I was also given the task of coordinating the entire information network of the states of Uttar Pradesh and Uttarakhand, which are like the largest states of the country. So there are almost 53 districts only in Uttar Pradesh, and it's almost like a city in a country. So three things which I will tell you, three striking things which I learned while being there. So as a neurosurgeon, I had no idea about nutrition. So when I would go inside the ICUs, a very strange thing. Do you know what these people would complain of? Those people who were very breathless, who were isolated in the ICUs, who had no family member to talk to, or they were all on drips, they were all on ventilatory masks. It's very strange. They would not say, oh, we want to meet our relatives. They didn't say we are lonely. They didn't say we are short of breath. They told me a very strange thing. They said, we are hungry. I said, what do you mean you are hungry? You're getting food, right? No, they said, as soon as we remove the non-invasive ventilation mask, the saturation drops to 70%, and they cannot breathe. So they have to put the mask again. As soon as they put the mask again, they cannot eat. So as soon as you start eating, as soon as you start swallowing, you cannot breathe. You understand? As soon as you start speaking, you cannot breathe. So therefore, this was the biggest thing, and I would never have known about it unless I'm there right in the middle of things, understanding what their fundamental complaint was. And there was a very simple solution. We put in a nasogastric tube and started feeding them. They were all conscious patients walking around with masks. But by just giving them a nasogastric tube, it completely relieved it. So my first thing is, just a ground level reality is completely different from what we learn in institutions. That's the first thing. The second thing we learned from COVID pandemic is the value of interconnectedness and scientific communication. You know, when you communicate with each other, your individual strengths becomes a community strength. And each one of us has a different strength to offer. So when this communication is established, which is very, very formal, which is very, very streamlined, then suddenly wonders happen. And within a very short span of time, we knew which hospital had a bed. So we never turned even a single patient away. Okay, if no bed is available here, please go to that place. And people would communicate on telemedicine on their ailments. So that was the second thing I learned. The power of telecommunication, the power of individual communication, which becomes a community strength. And the third very important thing that I learned was that we didn't have, when I went, we all were wearing hazmat suits made in China and in other countries. Every single antibiotic was coming from elsewhere. And then suddenly, everything we started making in India. And we made the max vaccinations in India. And then we started exporting vaccinations to other countries. And then we realized our inner strengths, which we did not even know existed, simply because there was adversity. And then we realized that our science and technology was completely geared up to meet these adversities. That's the fourth. And the fourth thing I learned, which is very important, is a fact of innate immunity, which each one of us has. So government had made all antibiotics free of cost, all antifungal agents free of cost. Crores of rupees were spent on it. There was no account, meaning nobody was taking any account. When we would get five major antibiotics and then do a blood culture on people, we will find that they will be the blood will be teeming with bacteria, teeming with fungal infection, despite of antifungal, liposomal antifungals and bacteria. So what was wrong? What was wrong was that we were not focusing on the preventive aspects of health, and we were not focusing on innate human immunity, which is responsible for global health. And as soon as this innate immunity kicked in, the pandemic disappeared. So these are some areas that we really need to focus on in global health. Thank you.
Thank you so much for these perspectives. And I hope you, as the audience, are keeping your questions or some of your burning questions for these important panelists who are really sharing a lot from the grassroots level all the way up to policy. I'm now going to hand over to Liz, the first presenter of her presentation.
just press there. Okay. Oh, there wasn't one? Okay, it's fine. Well, I'm gonna do this as entertaining as possible, right? I know we have some students in the audience, so I just wanted to talk a little bit more about my story and how it relates to global health and policy, right? Well, who am I? I already said it, right? I'm an immunologist, but I'm also a policy advisor and a science communicator. Here I am in better times at the White House. And why I did this transition from being an immunologist to a science communicator and a policy advisor, I start to noticing a disconnect between scientists and the public and policymakers, right? In the way that we think as scientists is we start thinking about a background for a scientific term, and then the supporting details that support that background, and finishing results and conclusions, versus the public and the policymakers, they want the bottom line first, like why are we even paying attention to all this? And the so what, and then at the end, the supportive details. And that's how I transitioned from being, first of all, a cellular and molecular biologist back home in Puerto Rico, to becoming a researcher and instructor in several countries, and then doing my master, my PhD in immunology, and then transitioning to be a fellow of the AAA Science and Technology Policy Fellow that, as I mentioned previously, it trains scientists into scientific advising and place them in agencies, in government agencies. I had the opportunity of serving at USAID. As you might know, it has been disintegrated since the Trump administration, and also at the State Department. And finally, I recently served as an advisor for sustainability for PEPFAR, which is the most successful global health diplomacy program. And I think all these roles that I had combined to my role of science communication and also policy and diplomacy advocate. That's why in all my responses, I try to integrate science communication as a very important piece of everything. So I know there are some students here in the audience, and I think this is beneficial for you. I really like this diagram, and I'm not going in detail on it for the sake of time. But I think these are 12 tips for building a career in diplomacy or scientific advising. And I put in red the enrolling fellowships and the engaging science outreach and communication, because I think in my case, they were instrumental in my transition from the lab to policy advising. And well, I did a lot of science communication, especially during the pandemic, right? And these are some examples. Most of it was to fellow Puerto Ricans or Latin Americans, and it actually gave me a purpose during the pandemic. And as several of our panelists mentioned, the importance of communicating with leaders from the communities and also being able to speak the same language as them. Going back to the fellowships, and if you have any questions, I'm happy to answer later on. I have the privilege of belonging to both of these fellowships, AAAS based in the US, STEP based in Latin America and the Caribbean. They are homologous, but they have different regional focuses. As a AAAS, I serve at USAID. I work in the Middle East, very conflicted region, especially now. And I work with a beautiful program that it was called the Middle East Regional Cooperation Program that gives scientific grants to Arab-Israeli scientists. And I had the opportunity of promoting new partnerships and reviewing scientific proposals. Again, bringing my scientific hat, but also my science communication and my policy hat together. And we did a lot. I like that Remy brought the point about One Health, right? Because that's one of the key points that we touched at USAID, how different interfaces converge. My role as an immunologist for this program and at USAID was basically on emerging pathogens, zoonotic diseases, antimicrobial resistance, and so on. But at the center of all, you can see the public health is at the center. So I really like that Remy brought this point because it's part of what I did as a scientific advisor when I work at USAID. And we had the opportunity of hosting a One Health workshop in Jerusalem back in 2023, in better times. And this brought together, it was beautiful to see Palestinian, Israelis, Moroccan, Jordanians, again, the science communication piece into global health in One Health, despite of the political challenges and the political climate in the region. So it was beautiful to see. And I learned a lot about intercultural communication, which is a huge part in policy advising as a communicator. Communicating is not only about the language, it's a lot. It's the way you dress, the way you treat others. And if you notice in these pictures, right, I'm wearing like very different attires. And I think intercultural communication is a very important process in diplomacy and scientific advising, and how we communicate with others, not only speaking, but also our physical language. And I wanted to bring that up. And lastly, I participated as a fellow working in US-Mexico scientific advising. I was the health person managing the relationship between the US and Mexico. I learned a lot about diplomacy, One Health, health issues, and it was an amazing experience and another opportunity to wear my science communication hat. And some of the issues that I deal in Mexico were related to US-Mexico health cooperation, specifically regulatory affairs. For example, how can we approve a medication in the US and have an homologous one in Mexico and vice versa? Maybe it sounds simple, but it's not, right? There is a lot of paperwork, as you might imagine, and a lot of bureaucracy and diplomacy involved. So one of my main roles was dealing through an initiative called the High-Level Economic Dialogue that was last year, and just facilitating that trade in medical equipment between the US and Mexico. Just another example of scientific advising and science diplomacy there. And I also had the opportunity of participating in something that was called the Economic and Health Dialogue of the Americas. Going back to the pandemic that one of the professors mentioned, how will we get all these lessons learned from the pandemic and leverage those lessons learned in order to be prepared for other emerging threats and future pandemics, right? Because more pandemics are coming. And I participated at the State Department in a very important fraction of it, which is called Foundations for Strengthening Supply Chains. And we were trying to look for ways for medications to be available in the Americas, in Latin America and the Caribbean. And I was able to convene a meeting with 70 delegates from 12 countries and like 10 regulatory agencies in the region, not only the FDA in the US, but also the Americas, in order to strategize how can we improve that supply chain resilience for better emerging threats and pandemic preparedness. I did a lot of assessment as a fellow as well in issues related to One Health with Oaxacan communities in Mexico. And I'm very proud of that. And I had the opportunity of publishing a book about it. Another example of how we can, as scientists, can influence minority communities and underserved communities as well. And lastly, I had the opportunity of serving recently as an advisor for sustainability with PEPFAR, which is the US President's Emergency Plan for Aid Reliefs. We had a huge presence in Africa. I know some of you come from Africa. Unfortunately, this program is in jeopardy due to the Trump administration, and I'm happy to talk about that during the discussion portion. But I just wanted to bring, unfortunately, I was terminated from my job, and I think this is very important to bring. Even though you're seeing all these experiences, like what's happening in the US, is really bad and it's really complicated, right? And I'm free to talk about it right now, right? But I think it's the way that we reinvent ourselves and we learn from these experiences. I was unfortunately affected by the executive order on foreign aid assistance. But at the same time, I've been able to meet and gather with working groups, specifically women. I'm with a lot of scientific attaches there in the Embassy of Germany in the middle, in order to conspire and think about ways forward. How can we leverage all these experiences and everything we have learned through the years in order to keep going, right? Because life must go on. So I think I just wanted to bring that. And, well, an image speaks more than 1,000 words, right? I think the state of the science under the Trump administration is affecting all of us, not only in the US, but also worldwide. And I think as scientists, we have a responsibility to know how to communicate, not only with policymakers, but also with the general public. And this is something that we discussed during the panel, and we're going to continue discussing. So if you're interested, right, come to me, and I'm able to talk to you more about a career in policy advising and science diplomacy. But I think it's important, like I mentioned, building expertise, participating in fellowships, attending events like this one and connecting with people, communicating effectively and getting trained to communicate effectively as well, and gaining practical experience and remembering that science is not partisan, is political. And I want to close with that. And thank you so much. Okay.
For that insightful and bold presentation. I'm now going to give Rakesh a few minutes because I think he also has something interesting, very interesting to convey as well.
So, thank you, Natisha, and the stage is already set for the immunology, and like we have learned about the immunology, and Dr. Sanjay sir has also highlighted that role of immunology in COVID. And what I am talking about is that safeguarding childhood immunological and rare disease awareness. So we are we are talking about the One Health, and that we will, if we will not reach to the last man or last child, which is like requiring the attention, that is because rare diseases are also important, and we have to discuss these things so that we can have awareness about these diseases. So what is pediatric immunology? And possibly immunology you know, but I'm just giving a stance that pediatric immunology is a branch of medicine that studies and treat children's immune system. And why we are so much talking about the children's immune system, because the immune system evolves in early years, and it has several implications in that. And immune system protects the children from the several infections, allergies, cancers, and because several malignancies or cancers are also because of the defect in immune system. And as a pediatric immunologist, so we are dealing with the children who are having a frequent or unusual infections, autoimmune diseases, when the immune system attacks the body, and the rare immunodeficiencies. And I'm talking about the two rare diseases which I am working on that. So why it is important to talk about the children's immune system? Because it's still developing, and early diagnosis and treatment of some of the immune disorders can change the way the children's, and that way, because the children's are they will live for next 100 years, I would say. So then that make a difference in that life. And so I am talking about the two diseases, that one is Kawasaki disease and about the primary immunodeficiency diseases. I'm just giving something like that. Kawasaki disease is feels like it's a very rare disease, but it's the most common cause of acquired heart disease in children, which is which we have already seen in the several worlds. So something which is seen to be rare, but it's a common cause of acquired heart disease in children. And it's in Japan, which reports almost 1% of children develops Kawasaki disease, and it's showing we have shown in Chandigarh also, and it's shown that this disease is there, and we are not diagnosing possibly. So why we are worried for this disease is that this disease has development of the coronary artery disease. So young children can develop coronary artery disease, something which we can see in a coronary artery disease in elderly adults, and which will impact the whole life of the children. So we have done a prediction analysis and shown that this disease is increasing, and possibly because of that, now we are diagnosing more, and because the ascertainment and acknowledgement is there. So second point, I'm talking about the primary immunodeficiency disease, and these diseases are really, really missed. And as a group, these are rare, but as a common, if I will take that one disease, it's a rare, but as a group, these are very common disorders, and collectively, each type is rare, but group, and the consequences are grave actually. The children develop infections, malignancies, and the treatment approaches are also different. And why it is we are not able to diagnose that? There is a significant lack of awareness. And if we will talk about the infections, we see infections a lot, and if we'll treat as an individual infection, then possibly will not focus a bit, but something like which we give a title that don't miss the forest for the trees. And if we'll collectively see the problems and then focus, then possibly, and there are limited diagnostic facilities at least 10 years back, but now the things are very, very much fine. So how can we deal? Because the innovation in diagnosis and management are very important, and the innovation starts from the grassroots level, something like that. We have to increase the awareness, training the local health workers, about these diseases. Genetic testing has shown, in last decades, we have seen that next generation sequencing, that genetic sequencing has changed the way we are treating these diseases, and we can diagnose these diseases very early in the, and that the portable diagnostic point of care testings, and most important, which Dr. Sanjay was also talking about, sir, that telemedicines, and we can reach to the remotest area of by the telemedicines or telecommunications, so that some grassroots physician is thinking about the disease, so that the tertiary care centers can also give a opinion. So we as at PGI are a WHO Center for Collaborating Center for Pediatric Immunology, and as a part of that, we are doing a training in Southeast Asia region about the pediatric immunological disorders, and we are supporting in preparing the diagnostic protocols and training of the stakeholders as requested by WHO. So one most important is that we are talking about this One Health, that equity and access is very important, because if we'll go to the Western several advanced centers that these diseases are how many, but we have to ensure the diagnostics and treatment for all children's community educations and partnership and affordable care models. So if I'll talk about affordable care models, I'll take example from my country, and I'll just say that in 2021 that in Government of India has launched a National Rare Disease Registry, and out of that we can treat the children, and that there is a allocations of fund for, so something which is coming in a big way, and possibly we can do more. So science communication and public trust, and Luz has talked about that science communication and policymakers has to understand that how this, and we can diagnose and treat these children. So social media outreach, and we have to talking about the clear, simple language for the families. So I'll end by saying that call for action says that engage, advocate, and change. We have to engage the communities. We have to engage the stakeholders, starting from the grassroots level to the policymakers, and we have to advocate for early diagnosis and treatment of these rare disorders. And if, as a researcher, we can change lives, and we are talking from last 2 years about the local and local for vocal, and then we'll go for a global. We have to identify the problems, and we challenge these problems from the local solutions, and then possibly we can blend with the global things. I will end here. Thank you.
Thank you so much, Rakesh, for that perspective. I think just like we started, we talked about how we would like to bridge the policy, research, science interface. And I think it's only befitting that we also now include the audience in this bridging module. So I have a host of questions that I could ask our panelists, but I think it's time that I give you a chance to ask a few questions. And if you have any direct questions that you would like to ask individual panelists, please feel free to do so. Questions? Okay, I have the first question at the back, I have 2 questions, and then I have the 4th question at the front. A mic, please. Thank you.
Thank you so much. I'm Nicole Lighthall from the US. I'm trained as a psychologist, and I work in an area that affects older adults who may be at risk for neurocognitive decline. So I'm a researcher. I don't work in policy. I don't do diplomacy. I do science communication. And I don't have an ambition to become a scientific diplomat, but I do want to have my work affect change. So what I'm more interested in, and perhaps our last speaker would be the best one to answer this question, is how do you speak to the right people who are in either local, state, federal governments, or international to give, communicate about your science and express the urgency and get them on board? Because we're in a position, if I'm a science diplomat, I'm already in the room with the people that can affect change. But as a researcher in an academic institution, I don't have that access. So one thing I've noticed is it's hard to speak to the right person. You're an email or you're a phone call among so many. How do you bridge that gap? How do you speak to them so that you can get them on board? And I'll just give you a quick example if you want to help me solve my problem. So I'm doing research on older adults being targeted for scams and fraud across various means. This is a big problem, and it tends to affect older adults with cognitive decline more, and we do research on that. But we need more support from our community, from our state and local governments to help proliferate these kinds of testing and tools and things that we're developing. So how do I get in the room? How do I speak to the right person? How do I get their ear?
So thank you for the question. So basically, what I understood is that, like, how to communicate and how to engage people, like whether we are reaching directly to the things. So I'll give an example which we did for the rare diseases, something like, so in India, there is an like science body, which is Indian Council of Medical Research, and ICMR does, on the basis of ICMR courses, we designed the courses for the early career doctors and clinicians, training regarding the basic things about this diseases. Something like we did the short courses for this. Something like we have to, because the problem is that the problems which are very common, they people know about that, but the problems which are not very common, or that they are not reaching to the something like rare disease registry, or something you are talking about, the scams to the older. So if the target population is a very restricted, that so then we have to reach that who can be helpful in reaching them. So something which we did there about that about the ICMR courses for the young pediatrician, physicians, internists, and possibly, and then they were and then there were some basic courses and advanced courses. So possibly we have to first increase the awareness, engage people, and if I am talking from the perspective of the patients and family, we have to tell them how they can get a treatment for this disorder, because something like which is a really difficult. If I'll talk about the primary immune defects, it's a diagnosing and then treating. It's a, because most of them may require a bone marrow transplants, and getting these types of treatments are not easy. So we have to target and direct them where they can get a benefits from the government. So something which I was giving an example of National Rare Disease Registry, and National Rare, part of that government is sponsoring the treatment of these rare diseases. And once government is coming, state is coming, then possibly treating these disorders is, so it's a multifactorial, it's a holistic approach. We have to collaborate with many people, policymakers, and then possibly, so it's may not be, I can't say that one solution can fit to all, but we have to design our ways to, like, for every problems, and that would be a problem oriented things.
I want to add something. Before I worked for the government, I was a policy advisor for a government relations firm, and we dealt a lot with the government relations office in each university. Most of the universities, I don't know if yours has, I imagine it has, they have a government relations office and a person designated to basically connect the researchers from the institution with senators and legislators from the state. And something that I did was organizing those meetings. Like, some of the universities hire people like me in order to be a liaison between the researcher and the policymaker. And we will arrange meetings in Capitol Hill in Washington, and the researchers will come and talk to them, and they will bring a one-pager, and we will train them on how to create a one-pager. Basically, it's like imagine an abstract about your research in very simple terms in just one page, as a leave behind for the senators, legislators, and then we will follow up with them. But I think the best way is connecting through your government relations office as an institution. The other thing is, you as a constituent, you have a right because you pay taxes, right? So you can definitely call your senator, find out who this person is, and arrange a meeting with them. And normally the staffers are very efficient on getting constituents to meet with the legislators, because that's their job. They're getting paid for that. So I hope those two things help you.
Maybe I would just add one thing here, and we already discussed that a little bit. Be persistent. If you do these things and you go to see whomever, or you do something on Capitol Hill in the US once and then you never go back, you have to be very persistent. And if you can, sometime in the type of field that you are maybe a bit more complicated, but bring patient, citizen with you, much more effective?
Usually, I'm on the other side of the table, making policy decisions for the institute. And researchers come to me all the time. And I have to balance funds with their demands, continuous demands. So I'd like to share a few secrets. I hope it remains within the room and not out, it doesn't go outside, because that makes me more vulnerable. However, the first thing is, you cannot imagine how ignorant policymakers are. You understand? So when you actually come and speak something, it's not often that we understand everything. You understand? You are speaking in scientific terms, and you are speaking about your very niche area, but that policymaker has absolutely no idea about it, and he doesn't know the importance of that in the scheme of things. So the most important point here is to somehow, in a simple language, convey the importance of the thing, and also not only convey the importance, its societal impact that has a huge impact on how decisions are taken. The second important point is, you also have to work backwards. Everybody responds to pressure. So sometimes the pressure comes from outside, not from within. So when you create an awareness in the society, and there are several of you applying the same kind of pressure, it really helps the policymaker come to a pathway of least resistance, which is to agree with you. That's the second point. The third point is, have you watched a Hindi movie, ma'am? No. Well, I'll tell you something. So all of us who have watched a Hindi movie, what happens is, after 3-4 months, we forget the name of the movie, we forget the plot, because most of us, the plots are exactly the same, okay? Boy meets girl, and then later on they meet again after some problems. But there is one thing we always remember, and that is those item songs. You understand? So each movie, all Americans and all other people from different countries ask us why we have songs in movies. The songs in movies are, just to not only give some relief from the plot, but also for you to relate the movie to that song later on. And you always remember and hum the song, whereas you've forgotten the plot of the movie and you've forgotten the name of the movie. I think everybody from India will agree with me. So how does it translate to you? When you go to the policy maker, you have to sing an item song which he cannot forget. What is so special about your demand, which makes it so different from everyone else, which really immediately relates to him, and which makes him reach out to you again, which is of benefit not only to you, but to him or her. That's a very, very important aspect. And one important point which I would like to tell all of you, when you actually go and meet somebody for the first time, it's very rude to talk about finances. So just go and meet and greet and sing your item song. Finances will follow later on, as soon as people become interested in your things. So it's very important that you need to just convey your thoughts and not talk about, immediately start talking about, oh, this money I want and this money I want. And suddenly, magic happens, and from somewhere all this money comes. And one more point I'd like to tell you, which I should not be telling you, but let me tell you. If you are a director or a chairman or a secretary or something, you are never taking a decision. The decision comes from below. And most of the people make the mistake of directly going to the top man and talking to a top man or woman and talking directly to that lady or the person. The important thing here is that there is a group, there's a chain of command which is actually making it possible for the top man to take a decision. You understand? And in order for that decision to be conveyed to the top man, it is very important for you to address the chain of command. This is something which 90% of the people don't understand. And anybody who's successful understands that you have to go to the bottom of the chain of command before you can actually approach the top man. These are some of the thoughts which I should not have told you.
All right, so I think we've got good perspective on some secrets that were shared. Moving on to the next question.
Thank you. Yeah, it's Dr. Kalpana Nagpal from INEAS. So my straightforward question, with the context of antimicrobial resistance, which was a bit untouched during that panel discussion, it's like it is going to cause at least 10 million deaths by 2050 annually if unchecked. So, and it drives beyond the hospitals into food, environment, and nutrition system. With that context, the antimicrobial resistance rising globally, and often it is linked to the poor infection control, overuse of antibiotics, and even the food systems. How, as different parts of your domain, can you a bit highlight on how can we integrate health, nutrition, and the pharmacy practices to help the policy makers mitigate that antimicrobial resistance, especially in the vulnerable communities like Global South? Thank you.
Any one panelist would like to answer?
Thank you for your question. It's very important. I did mention antimicrobial resistance very briefly, right? I think, I deal a lot with that in the Middle East, specifically in Egypt. There was a very interesting project in Egypt going on that I think it was amazing. And they were actually scientists partnering with MDs, with medical doctors, in order to create capacity building training for policymakers, but also for scientists in general, and how to address this antimicrobial resistance in Cairo, specifically, within the hospitals. So this is like grassroots efforts, right? Very local. Because when people think about policy, sometimes they think about the federal level or at the country as a whole, right? And policy is not only that. You can start with small efforts, such as capacity building and partnering with different stakeholders, including medical doctors, PhDs, scientists, even nurses were part of this program. In order to benefit a small community, like in this example was Cairo, a specific hospital. So it was very niche, but it was a good start. So I think it's important, and this is a scientist, we have that civic duty, all of us have, in every front that we have to put, to make our effort as much as we can. But yeah, just to give you an example, that capacity building is one way to go in order to affect those policies at the regional level.
Yeah, and just to add a bit more to that, and again, coming back to INSA, it's really, really ground up and taking into consideration the context. Someone talked about before culture, delivery of science advice, taking into consideration the culture, the context, the language, very, very important, because often we go with one kind of way and it doesn't work in many parts of the world. So you have to adapt, and going ready with citizen, engaging citizen early in this process is very, very critical.
Okay, so I'll let you ask your question, and then we have one question on that side there.
Thank you to all the panelists. Indeed, a very insightful discussion. I'm Fahmida from INSA, Science Comment Policy Researcher. So I have two questions. Very first related to the policy, that whenever any policy and guideline drafting take place, there will be like a proper process of formulation of the policy. They have so many consultations, public consultations, interministerials, and governance consultation. But when we comes at the part of the implementation, it's like we usually fail into it. So what's the obstacle behind that? That we put so many efforts in drafting the policy, but when it comes to the implementation part, we fail like anything, first. Second thing is related to the science communication, and we are talking about so many things about science communication, and during the COVID-19 pandemic, we have been witnessing that the lack of mainstreaming science communication is quite prominent, and the fake news is in the mainstream is quite dominant. We do not have any as such mechanism out there and the framework out there that we can assess that who will be the responsible if something is circulating out there on the social media. Now there's people very primary things to get it from layman people, basically getting all the information from the social media. So who will be responsible for the same? If something is circulating with fake or misinformation, as a scientist, as a researchers, who will set the accountability for us? That it should be our social scientific responsibility at all. So I need all of your inputs and insights on that. Thank
So
you.
can I, in the interest of time, can I just have two panelists responding to that?
So first is implementation. There is no way of implementing anything without enforcement. Please understand. Don't think I'm a Hitler or something. But to be very honest with you, you have to enforce things till it gets into the psyche of the system. And once it gets into the psyche of system and people kind of absorb it like a usual routine thing, then it becomes like a habit. Till it becomes a habit, there has to be some enforcement. To just come back to that antibiotic policy, there is no way an antibiotic policy can be, an antibiotic resistance can be actually circumvented unless there is a very clear-cut antibiotic policy which is enforced by every hospital, wherein a higher level of medicine cannot be prescribed by a doctor till a pharmacist is actually certifying that this could be given. And the microbiologist is certifying that for this particular organism, this is the lowermost antibiotic which should be given. It will not. And there has to be a clear antibiotic policy, which is an institutional antibiotic policy, and there should be guidelines in journals which will actually tell you what that antibiotic policy should be. So one is enforcement. Without enforcement, there is no implementation. Coming to your second question, which is all these rumors which go on, and I mean, as you go up higher and higher, every single day, you are inundated with this pressure of social media, where true or false, anything will go in your name. Somebody will, one day I get phone calls that, oh, somebody with your WhatsApp face is asking me money, should I give it to him? Anything will go. I will just give you one thing. You talked about responsibility, right? What should be our responsibility? Responsibility is made of two words. Okay, it's a swar sandhi. In Hindi, we call it swar sandhi. There are two syllables which make up responsibility. That is response and ability. It is your ability to give a response. Okay, and if your ability to give a response is a mature one, then no matter what the provocation is, it will die down because it's not true. But if you give a response which is aggressive, which is unsuitable to your position of responsibility, then that is exactly what that provocator wants you to do. And you are actually playing into his or her hands. You understand? Thank you.
Okay.
1 minute.
Yeah, 1 minute, real quick. The first thing is your second question first. I train scientists on personal branding and social media management, and I think those are very important components, right? And you don't always have to react, right? And I think it's a responsibility, especially during this time of misinformation and disinformation, which are two different, separate things, to be able and to know how to communicate, not only with the public, but also with other scientists in other disciplines. So I think going back to the capacity building aspect, getting trained, there are some courses out there. And of course, it's a matter of practice as well, and the way that you feel comfortable. And your first question about how some policies they're not fruitful, unfortunately, that's the way it is, right? And going back is the disconnect between policymakers, when there is a legislation that is affecting at the local level, at the state level, it's very difficult to implement for example, at the federal level or at other stages. So there is a lot of things that come to play. Also, science, even though as scientists, we want science on the forefront of every policy, it's not always like that. And we saw that during the COVID pandemic, right? Some of the policies and decisions were made based on the economics because that's an important part of society. You cannot pretend that every business close because it's gonna create like a collapse, right? It cannot be like that forever. So it's a lot of things that come to play, and it's unfortunately but true.
Okay, I think in the interest of time, I'm not going to allow any further questions because we will be behind schedule. I would need to wrap up this session. I think if we continued with questions, we'd be generating a lot more ideas of how we tackle the policy research interface. Very quickly, to just summarize some of the things our esteemed panelists have indicated is that individual contributions are useful, but for capacity building, there needs to be a circle of influence that increases this. We also need to be talking about One Health and the trust in science. We do not need to work in silos, but we must come together and interact with stakeholders at all levels, and that science communication must be tailored and relevant. Other things include that we need a holistic approach to have broader collaborative efforts and also to foster youth representation. I want to thank this panel. Prof. Remy, thank you so much. Liz, thank you so much. Prof. Debashish, Dr. Sanjay, and Dr. Rakesh. It has been a really insightful time, and I know you have a lot more secrets to share, but we can do that later on in the day as we mingle. I hope you've enjoyed this panel, and thank you very much. Mutrika, I'm going to hand over to you.
So may I request all the dignitaries to kindly grace the sofa of the stage. Thank you. नहीं है main session. Request you all to kindly stay in the auditorium. We continue the concluding session here as well in a minute. Okay, welcome back everyone. I request you all to be kindly seated. We'll start the concluding session. I'm sure you all had 1.5 day long of 4 sessions, extremely exciting, enlightening sessions where you had fantastic moderators and the panel of speakers. Now to have a complete overview, summary of the last 2 days that we have witnessed, I invite Wilson and Zhao to present the summary of the last 2 days.
Hello, everyone. So we are very happy to be here also on behalf of the Program Organizing Committee. It was really a great effort by a lot of people. I am here with Wilson. We are both colleagues together with Rim. Rim is, I don't know where she is. She's in the back. She was a bit shy to come here. But of course, I mean, we are working a lot together with the local organizing committee, and we had a lot of support along the way. So I think it was a quite great experience over the year to meet everyone and also discuss and be able to shape the program for this conference. I think we had 4 great panels here, a lot of discussions and actionable advice that people now we should follow up and also try to engage with everyone. And of course, just from the POC, thank everyone to contribute. Also Aram, Veda, Tatri, Funman, Muhammad, so some of them, they are not able to come here to Hyderabad, but of course they were instrumental in raising this program, and we are very thankful for the discussion that we had over the last year. And of course, again, Chandra and the LOC, of course, they are very kind also in receiving our comments and suggestions. I think we worked very well together over the last year. We almost met every month, at least once. And also, of course, Jennifer made our life much easier also in trying to engage with everyone and building this program. So I would like also to ask for an applause to everyone that was involved in this POC. So now there will be also, of course, a conference statement that will be jointly produced by GYA and INEAS. So we'll be working on that, and then most likely maybe in the upcoming weeks, GYA and INEAS will make it happen and will come out. I think, again, I will just give the floor, of course, to Wilson. I'm sure that you will have some words to give. Thank you very much from my side.
Thank you very much, Joao, for making this very good statement and summary of the last days. And I'd like to take, on behalf of the POC committee, also to all the moderators and speakers. We have been having a lot of meetings to shape this extraordinary conference. And I would like to welcome again the new members and the senior members. Now we are part of the senior members. And thank you very much. And I'd like also to thanks to the LOC committee, because it has been not possible without the hard efforts and hard work of the LOC committee and the many meetings between the POC and LOC and the GYA office. And thank you very much for all of you and the speakers for have the time to come here, because we know that you have a very busy agenda. And thank you very much for being here and to share your knowledge and with the new voices, with people that want to change really and have impact on the world to make a better future forward. Thank you very much.
Yeah, just mainly for those of you that never organized the conference, I think this is a very nice opportunity also to get involved. So you learn a lot along the way. You meet people, then you meet them in person, which is great. So I think it's, try to be involved as much as you can. Of course, we have our commitments, but this is really what drives the organization, GYA. So please take advantage of the opportunities that are for us and try to learn and grow together. So I will maybe call also Chandra to give some remarks on behalf of the what? Yeah.
Thank you, Joao and Wilson. So there's a slight change in the program which you were not aware of. So we were waiting for our director, Professor B.S. Murthy, IIT Hyderabad. And I now invite Director B.S. Murthy to talk about the various innovations that we have done in academic research and the overall development of young researchers like us at IIT Hyderabad. We thought this would be a good opportunity to take back certain lessons that we are doing here.
Thank you, Mudrika. Yesterday I was very, eagerly listening to all the innovators. There was a session on innovation and entrepreneurship. So that, led me to request Chandra if we can talk a little bit on the kind of innovations that happen at IIT Hyderabad. Just about 5 minutes. I thought I will take your time because this is something which we strongly believe is required, particularly for India. India, our Prime Minister keeps talking about what is called Viksit Bharat. For those who are non-Indians, who do not know this word, is basically, if you can translate it into English, it is a developed country, developed India. So if India has to become developed, we strongly believe that innovations are essential. And innovations can come when there is a free mind. And we strongly believe innovations can come more from younger people, all of you sitting here, than older people like me. So how do we ensure that the younger people are empowered and given a kind of a freedom so that they become more innovative is something that we have been experimenting last 5 years, more or less. And some of those which I want to share with you. We go to the extent to say, I do not know whether anywhere it is written here, IITH for us stands for what we say. If you have ever gone to IITH website, you will see a slogan which says, inventing and innovating in technology for humanity. For us, IITH is not simply Indian Institute of Technology, Hyderabad anymore. We say it invents, it also innovates and develops technologies for humanity. The H for us is humanity. So this is what we strongly believe. And we started implementing various features to ensure that kind of innovations come through our younger minds. And we started even with an undergraduate students. So we ensure that unless there is a freedom to undergraduate students, innovation cannot come. So to ensure the freedom is given, for example, we have an undergraduate program. Most of you come from academic institutions where there are undergraduate programs, where there is usually a definitive curriculum. Okay? We have one undergraduate program at IIT Hyderabad, which we call it as B.Tech in Engineering Sciences, where the 130 credits, every undergraduate student goes through 130 credits. The 130 credits are in the hands of the student. The student decides which 130 credits he or she wants to do. This is the only institute possibly in India which has such a program where the institute does not create a program with a curriculum, a free curriculum. Okay? So students are free to take, maybe a student will take a few mechanical engineering courses, a few electrical engineering courses, a few computer science courses, few physics courses. You can choose what you want to be. We go to the extent to say that at 18 years of age in India, you can select who should be the Prime Minister or a Chief Minister of a state or a Prime Minister of the country. We say that if that kind of a freedom is available for a young kid, why can't he or she choose what he or she wants to become? This is the kind of freedom that we give. Even a regular undergraduate program, for example, if a student is joining mechanical engineering, we say only 60% of the total 130 credits will come from your mechanical engineering. The remaining 40% is in your hands. Okay? So we give to that extent that there also you can pick up courses from anywhere in the institute that you want. You can even pick up courses from outside the institute also, so that you can add value to yourself. We also believe that while engineering is mostly a left brain activity, right brain activity is also equally important. And we say, let there be at least 10% of the total credits coming from liberal arts and creative arts. IIT Hyderabad, no student who joins for an undergraduate program can leave the institute unless they do 10% of the courses from liberal arts and creative arts. Starting from anthropology to psychology to philosophy to music, dance, painting, okay, our students do all these courses. So we believe that that leads to a kind of a balanced personality who can now start thinking of, out of the box. And to make them think out of the box, we started a program which we call it as BUILD program. Bold and unique ideas leading to development is the name we give, BUILD. Okay? So every semester we call for proposals from our students. We say that, do you have any innovative idea? A first semester undergraduate student also, if they have an innovative idea, we give funding to them. We provide a mentor. We have a building very close to this building, which is called a TIP, Technology Innovation Park, if you have seen. While walking, you would have possibly come across. It's a 150,000 square foot building. Possibly the largest such building in the country for innovation in any academic institution is IIT Hyderabad. We give space to them there. You say, you go ahead and innovate and do something. We go one more step further and say that if you have innovative ideas and you don't want to get disturbed by the courses that you have in your undergraduate program or a postgraduate program, take a semester break. We give you 6 credits. Don't do any courses. Just focus on your innovative idea. Come up with a product. At the end of the semester, show us a product. Okay? And we conduct a kind of an oral exam and give you a grade for that. 6 credits out of about 15 credits of the semester. You get 6 credits. The balance credits you do in other semesters, take one extra course and finish all the credits at the end of 4 years. We also tell them that at the end of second year undergraduation is for 4 years in India, possibly true for every other place also. We say, if your ideas are working out well, now take a break. Start your company on your own. Okay? We give you a diploma. And we say that we give you 5 years time for you to come back and complete the remaining 2 years, third and fourth year of undergraduation. This is possibly the only institute in India which does this. And we are actually very happy if a student after 3 or 4 years comes and tells, I don't need your degree anymore. Okay? I am already successful. So this is the kind of people which we believe India needs. And we say, let us create people who do not seek a job, stand in the queue for placements at the end of the 4 years, but create jobs rather than seeking jobs. And we started seeing results of all this. We started a minor in entrepreneurship. We started a double major in entrepreneurship. We started a department of entrepreneurship. Okay? Very unique department. While most of the IITs have management departments, we have a department called entrepreneurship department, which offers an MTech called MTech in Techno-Entrepreneurship, which is a very interesting program, again, first time in the country, where at the end of 2-year MTech program, the student will have a product in hand and a business model for it. Okay? The student will have one engineering or a science faculty supervising them, one entrepreneurship faculty co-supervising them, so the student knows how to make a product and how to sell a product. This is a very, very unique program which does not exist anywhere else in the country. And all this has led to, in the last 5-6 years, we have close to about 260 startups at IIT Hyderabad. They have created, in Indian rupees, 1,500 crores of Indian rupees, which is equivalent to about 200 million US dollars. This is majority by students and faculty of the institute. And this is something which is feasible, and we have demonstrated this. We even went to the extent to all the young faculty said, any number of patents that you want to patent, IIT Hyderabad will completely fund you. And in the last 5-6 years, we have more than 500 patents. Please remember, IIT Hyderabad is just 16 years old. We are sweet 16. Okay? And this sweet 16 young kid is doing all this. And last 1 year alone, we have 219 patents in 1 year. And for this year, we have already set a target. We say Mission 365. We say a patent a day. And for your information, by the end of May 31st, we have 120 patents already filed. In fact, on March 31st, I was told that 90 days, 90 patents were filed. And we are moving towards the 365, which on December 31st, we want to demonstrate. I do agree that patents are not everything. Commercializing those patents is important. But trying to transform the mind of a professor who always wants to write a paper, okay, to saying that you can also patent at the same time you can also publish is a transformation that we are able to bring in at our faculty members. So all these is certain innovations that we are trying to ensure that there is a lot of enthusiasm in creating a new India. And IIT Hyderabad has taken steps, and I'm sure many more institutions will follow this in future, and possibly some of these can be implemented in some of your institutions. I don't want to take more time. I asked for 5 minutes. Thank you so much. Thank you, Mudrika. Thank you, Chandra.
Thank you, sir. May I now invite the POC members on the stage for a photograph, please? All the POC members. All the program organizing committee members. Should I count till 10 so that you are here? Please come on the stage. Do you remember anyone who is missing here? Okay. Thank you. May I invite Chandra for the closing remarks, please?
Honorable guests, distinguished members of the Global Young Academy, my INEAS colleagues and friends. As we gather here to conclude this remarkable international conference of young scientists, I am filled with immense gratitude and optimism. Over the past 2 days, we have exchanged vibrant ideas, forged meaningful collaborations, and reaffirmed our shared commitment to advancing the science for the global good. This gathering has not only showcased the intellectual strength and the rich diversity of our scientific community, but has also reminded us of the power of unity and common purpose. I extend my deepest thanks to our distinguished panelists, whose groundbreaking insights and thought-provoking presentations laid the intellectual foundation of this conference. To our moderators, thank you for guiding each session with a grace and clarity. Your skill in balancing diverse perspectives and fostering the genuine dialogue ensured that every session was inclusive, dynamic, and impactful. You brought out the best in every speaker and wove together a rich tapestry of knowledge and engagement. To my ZYA friends, you are the heart of this gathering. Your energy in the panels, workshops, and informal conversations enriched us all. You traveled from far corners of the world, and your enthusiasm and participation made this conference truly memorable. Your questions, ideas, and shared experiences are the lifeblood of our vibrant community, and thank you sincerely for being there. I would also like to thank our co-organizers, Indian National Young Academy of Science, INEAS, Indian National Science Academy, INSA, and the Government of Telangana. Behind every successful event stands a team of unsung heroes and the wonderful hardworking staff of IIT Hyderabad. In particularly, I wish to acknowledge the unwavering support of our Honorable Director, Professor V.S. Murthy, and his office. I'm extremely grateful for the support extended by the various sections, including the SRC office, finance office, security office, CMD, guest house, CC, green office, and PR office. Each one of these sections raised on the occasion to make this event memorable. I'm deeply grateful to all the sponsors. Our diamond sponsors, Career Technology and Scient, believed in and their belief in the promise of young scientists and early career researchers. InMovie Advertising joined us as a platinum sponsor. We are equally honored by the steadfast support of ANRF, Department of Science and Technology, Department of Biotechnology, Office of the Principal Scientific Advisor to the Government of India, the International Science Council, and the Japan Science and Technology Agency. Our silver sponsors are Anton-Par, Next Bharat Ventures, JITF Ecopolis, VRNS, Canara Bank, Wiley Publications, CSIR IICB Kolkata, and American Chemical Society, while few other supporters like Biologic India, Bad Soul Private Limited, and Ambron have each played a vital role in making this gathering possible. Every contribution, large or small, made a difference here. It has been a privilege to collaborate with such a passionate, diligent, and visionary local organizing committee and the program organizing committee, POC. Your pursuit of excellence was evident in every detail. Our dedicated volunteers have been the backbone of this event, seamlessly coordinating the logistics and hospitality behind the scenes to ensure everything ran smoothly. As we look ahead, let's carry forward not just the knowledge shared and the connections made, but also the spirit of collaborations that has defined this international conference. Let this movement mark the continuation of conversations, the deepening of partnerships, and a renewed commitment to our collective mission. To our GYA members from 60 countries here, your spirit, enthusiasm, and energy have been an inspiration. While we return to our countries after the AGM, let us remember the wisdom we have gained and strive each day for excellence in science, leadership, and service to the humanity. With that, it's my great honor to formally declare the closing of 2025 International Conference of Young Scientists. Thank you.
Thank you. Before I let you have your lunch, I have a question. Who traveled the farthest for this event? Anybody who traveled over 24 hours? Look around. You might want to recognize, no? Who traveled the fastest? More than 25 hours? 26? 27? 28? Wow. 30 hours? Wow. 32? Wow. How long did you travel for? 2 days, 48 hours. What about next to you? 45? Wow. And at the back, somebody was raising hand. Anybody over 45? Only 32. Only 32. So you felt loss of 2 days, gain of 2 days. I mean, you will have that shift, right? Anyway, I just thought it's just curious to find out who traveled the fastest. I do have a few announcements before you go and have your lunch. We'll start sharp at 1:45 p.m. here for the EC pitches. We do not have too much of time, so 1:45 to 2:45, and then at 3 o'clock we need to start for the excursion. So 3:15, request you all to assemble at the registration desk. All of you know registration desk? Fantastic. There are, yes? Sorry? No. So I'm saying registration desk in the convention center where the earlier seminar rooms were. So that's where you will assemble at 3:15 sharp. There are chances of rains, so please carry your umbrellas. Your passports are not required. Try not to carry them so that we don't lose them. But your conference ID badges are definitely required with you. In case you do not have that, I hope there is no case like that, please contact one of the volunteers or contact me or Chandra. The buses are numbered 1, 2, 3, and 4. When you climb a bus, remember your bus number so that while coming back, you come back in the same bus. This is to ensure that all of you are brought back to the campus. We don't want to lose anyone here and have more than 48 hours of travel. There are going to be 2 volunteers and 2 local organizing committee members, 3 volunteers and 2 local organizing committee members in each bus. So you're all safe. Please do not worry. You can pick up some snacks like fruits and muffin and juices and water at the reception when you collect, and you'll be given a paper bag, so you can just feel free to pack food for yourself to survive till 7 o'clock. That's when the dinner will be served approximately. And before I say bye, do visit the exhibition stalls set up by our sponsors to acknowledge their contribution and also take away some learnings if they have anything for you. But for now, thank you everyone. Let's proceed for lunch. Thank you everyone.